Hello, greetings to one and all from SPARSH Hospital of Advanced Surgery at Infantry Road, Bangalore. I am Dr. Arvind Bhateja. I am the head of Neurosurgery and Spine Surgery Services at this unit. Today I would like to talk to you all about the latest world-class technology that we at SPARSH are using in our neurosurgical operating theatres. We have the Zeiss Kinevo 900 Neurosurgical Microscope, which is a one-of-its-kind piece of equipment. It's a totally world-class neurosurgical microscope which has advanced capabilities such as tumor fluorescence, intraop angiography, and an inspection tool. This really enables us as surgeons to perform surgery with the utmost precision, and using adjunctive features such as fluorescence and intraoperative angiography, it helps a great deal in ensuring excellent outcomes for patients with all kinds of neurosurgical problems ranging from brain tumors to aneurysms and spinal tumors, spinal fixations, spinal decompressions, etc. With this, we also have what is called an exoscopic feature, where we can look at a high-definition 4K monitor in 3 dimensions, a 3D monitor, and use that to perform surgery very precisely. So we're very pleased to have this latest state-of-the-art neurosurgical microscope, and I must say that I never believed that a microscope of this kind could make such a difference to patient outcomes, but I'm amazed and at the same time delighted to see that it has made such a huge difference. In addition to that, we also have the O-arm and neuronavigation. Navigation can be used for both brain as well as spine surgery. The O-arm is used along with neuronavigation to perform highly precise, very accurate spinal fixations, both in the cervical, thoracic, and in the lumbar spine, giving us 3-dimensional real-time anatomy of the patient's spine in the operation theatre. This is also a one-of-a-kind feature that we have in SPARSH, and this is another thing that makes minimally invasive spine surgery highly feasible and very precise, and shortens patients' recovery times and analgesic requirement in the post-operative period. So we'll be delighted to interact with any of you and look after any of your patients who might be needing our brain and spine surgical services anytime in the near future.